Hello everyone. Today we will study about atrial fibrillation. So, a 83-year-old female patient came to our hospital in Agra and she have the presenting complaints of palpitations with skipping heartbeat. And she told me that she feels like her heart is banging on her chest wall, banging of heart on the chest wall. And this symptom it aggravates when she bent down. And her third symptom was nausea, nausea with lightheadedness, and she have the feeling she used to feel weak all the time, weakness, tachycardia, and the characteristic symptom with tachycardia over here is that she have longing for air. She cannot live with fans off and doors and windows closed even in winters. She used to switch on her fans in winters because she have longing for air. Tachycardia with longing for air and chest pain with irregular pulse. Sweating. And she narrated that she developed all these symptoms before uh, 1 year. And these all are the characteristic symptoms of atrial fibrillation. So now the pathology of the atrial fibrillation. But before telling the pathology of atrial fibrillation, I will tell you the normal functioning of the human heart. So first of all, we will make a heart, a diagram of a heart, normal heart. So this is the right atrium, left atrium, right ventricle, and left ventricle. So in the right atrium, we have the SA node over here. This is the SA node, and between the wall of right atrium and the right ventricle over here we have the AV node. And between the two walls of the ventricles, these are the bundle of his. and over here we have the Purkinje fibers. So now what happens is, when the blood enters the right atrium by the superior and the inferior vena cava, the SA node it activates. The SA node activates it and it generates its electrical impulses, which is an SA node. The generation of the electrical impulses by the SA node is responsible for the contraction of the atrium. So the atrial contraction takes place, and after which the right atrium will transfer its blood to the right ventricle, and due to this, the AV node activates and the AV node will generate its own electrical impulses. There are basically two functions of the AV node. The first function is, whenever the SA node is not working properly, the AV node will take place of the SA node, first function of AV node. And the second function is, AV node always protects the ventricles from the atrial arrhythmias. So these are the two basic functions of the AV node. So now when the right atrium it transfer its blood to the right ventricle, the AV node will generate its electrical impulses, and now the AV node will transfer its electrical impulses to the bundle of His. This bundle of His. AV node will transfer its electrical impulses to the bundle of His. Now the bundle of His will command the ventricles to contract. And now the bundle of His will transfer its electrical impulses to the Purkinje fibers. And the cells in the Purkinje fibers, they coordinate the whole cardiac contraction. So this is the normal electrical functioning of the human heart. So now the pathology of the atrial fibrillation means what is happening in atrial fibrillation. So when the SA node is not working properly, SA node is not working properly, so there will be atrial arrhythmia. Atrial arrhythmia, which means atria are not working in rhythm, and there will be irregular atrial rhythm between, or you can say irregular atrial rhythm between 300 to 600 beats per minute. So the atrium are working in such a fast speed that the heart rate will be 300 to 600 beats per minute. So due to this excessive rapid rhythm of the atrium, of the of both the atrias, the ventricles will not understand what the atrium wants to say. So there will be dysynchronization between the atrium and the ventricles. Between atrium and ventricles. So in this situation, if you put a stethoscope on the patient's chest, you will find out the heart rate of the patient will be 300 to 600 beats per minute. And at the same time, if you check the pulse of the patient, his pulse rate will be absolutely normal between 80 to 100 beats per minute. And how come is this possible when the heart rate is so rapid? How the pulse can be so slow? So the reason behind this is that the atria are working in such a fast speed in this condition. The atria are working in such a fast speed that the ventricles are not able to contract properly, and therefore the ventricles will not able to push out the blood from the heart. So there will be decreased pulse rate. So this is the classical sign of atrial fibrillation, when the heart rate is excessively rapid and the pulse rate is normal. So now, what are the etiologies responsible for atrial fibrillation? It can be due to COPD or coronary artery disease, valvular heart disease, hypothyroidism, and if a person who takes excessive alcohol or caffeine. So in cases of COPD, due to excessive smoking, and atrial fibrillation, it develops in COPD when the COPD gets worse. So due to excessive smoking, the COPD it gets worse, and uh, it damage the cigarette smoking, it damage the nerve fibers of the heart. Nerve fibers of heart. So they so due to the damage of the nerve fibers, the atrial fibrillation is developing in cases of COPD. In coronary artery disease, there is persistent which high blood pressure, which eventually uh, damage the electrical rhythm of the heart. In valvular heart disease, due to stenosis of tricuspid valve, will lead to enlargement of right atrium, which will damage the SA node of the heart, and this is the reason of atrial fibrillation in valvular heart disease. So now, how hypothyroidism is responsible for atrial fibrillation. In hypothyroidism, there is increased TSH level, means thyroid stimulating hormone is increased in the cases of hypothyroidism, and it always interferes with the normal electrical conduction of the heart. Normal electrical conduction of the heart. And in this case, This female, she was a patient of hypothyroidism, and later on she developed atrial fibrillation. Now the last cause of atrial fibrillation, that is alcohol. As we know that the alcohol have the diuretic nature, and due to this diuretic nature of alcohol, kidney passes a lot of water and sodium, potassium from the body into the urine. And due to loss of this high amount of sodium and potassium from the body, there is electrolyte imbalance. And electrolytes like sodium and potassium, these are responsible for the normal conduction of the heart. So now the investigations of atrial fibrillation. So the investigations we recommend the patient of atrial fibrillation is ECG. The first investigation was ECG, and as we all know that in ECG there are this, I'm making the diagram of a normal ECG. So as we all know that this is a normal ECG and this is the P wave. P, Q, R, S and T. P wave always denotes atrial depolarization. P wave means atrium, atrial depolarization. Atrial depolarization means atrial contraction, and QRS complex means ventricular depolarization. Means ventricular contraction, and T wave denotes ventricular repolarization. And this irregularity of the QRS complex is there because the ventricles are fine, they are doing well, but they are confused with the signals coming from the atrium. Means ventricular relaxation. And in cases of atrial fibrillation, there is absence of P wave because the atrium, they are contracting in such a rapid way that the ECG, that in ECG we cannot find the P wave. Like in this picture, if we see in this picture, there is no P wave, we cannot find any P wave. So there is absence of P wave in cases of atrial fibrillation. And if we see the R waves, these are the R waves. The R waves in a normal ECG, in a normal patient, the distance between the two R waves is 300 milliseconds. And the distance between all the R waves are similar in a normal ECG. But in this ECG we can see that there is irregular distance between all the R waves. So this denotes irregular rhythm. So because of this, somewhere the QRS complex is rapid and somewhere the QRS complex is slow. And if we see the QRS complex in this picture only, we can see that The QRS complex is irregular. There is irregularity in the QRS complex. And this irregularity in the QRS complex, it shows irregular RR intervals. And now the complications of the atrial fibrillation. The biggest complication of atrial fibrillation is stroke. It can be cerebral or cardiac. In my next video, I will tell you about the cerebral stroke due to atrial fibrillation. Now the homeopathic medicines. In cases of atrial fibrillation, we can prescribe the patient digitalis. It is one of the best medicines for atrial fibrillation. Nux vomica. Most of the symptoms that the patients persist in cases of atrial fibrillation, they are of digitalis. In the cases of digitalis, there is palpitations, which aggravates on slightest movement. And there is palpitations with skipped heartbeat. So that is the reason why digitalis is considered to be one of the most prescribed remedy for atrial fibrillation. And we prescribe nux vomica when the patient is a drug addict. And like alcohol, smoking, and the next medicine we prescribe in cases of atrial fibrillation is thea. Thea sinensis. In thea sinensis, there is palpitations, with congestive feeling in the chest. And the next medicine we prescribe is ignatia. Ignatia, when the palpitations they developed due to any emotional grief. And the patient will present herself with changeability of the symptoms, like changeability of the emotions. At one moment she will laugh while narrating her symptoms, and the other moment she will cry while narrating her symptoms. And in these kind of cases, I have prescribed ignatia, and I have seen a remarkable results in those patients. So this was all about atrial fibrillation. Thank you.